Hi, my name is Heather. I'm a veterinarian technician here at Lombard Veterinarian Hospital, and I'm here with Mike, who's going to ask me some questions.
How do a cat's nutritional needs change as they age?
Well, as they age, their nutritions change quite a bit, especially because they do tend to slow down, which puts them at higher risk for obesity. So you want to have them on a lower fat with a higher protein food just to lower the risk of them getting obese in the end. And also you do want them to have on a food that has different nutrients to help, like their joints would have, some of them have glucosamine in them, and then they'll also have different antioxidants in them just to help boost their immune system and help keep them as healthy as they can be.
What are some signs and symptoms that your cat may be slowing down?
A big sign of that is they might be eating less, they might be sleeping more, not wanting to drink water, they're having a harder time going up and down the stairs, or they aren't doing normal things like jumping off a bed like they used to do.
What are some health complications or diseases that are commonly experienced by senior cats?
With senior cats, a really big health complication they tend to have is renal disease or renal failure. It is usually seen by doing blood work, and that's a big one that they do tend to face. Another problem they tend to have is loss of muscle mass. They're looking at thyroid problems, dental disease, or heart disease.
What kinds of preventative care can help extend the life and health of my cat?
Anything like a wellness checkup and getting blood work. You can get them on some supplements and nutrients at an early age to help their joints. Keeping their weight as minimum as possible can extend their life, because if they are heavier, then their joints are going to experience more arthritis, which is going to make it harder for them to walk. You also want to add probably more wet canned food in their diet, just because cats have a tendency to not drink as much water, so you want to keep their water level higher to help preserve their kidneys and other organs.
Why are wellness exams and regular checkups important for senior cats?
They're important because that's when you're going to catch the early start of diseases. Every wellness exam and a senior checkup should probably include some blood work, just to make sure, like I was saying, with their kidneys, that's a big thing, and by doing a CBC or a chemistry, you can see what their kidneys are looking like, and to see if you got to start them on a kidney diet, which would consist of a lower protein and low phosphorus, or if they're going to need fluid therapy. Another thing is it will check for thyroid problems, which cats are very common to start to have, or even by doing urinalysis to help check their urine, check for diabetes to see if there's any protein from their kidneys or anything, or glucose in the urine. Along with that, you want to get them checked out for some dental disease, just because dental disease is another big thing with cats, and if you don't get it fixed when it's starting, they can get things called tooth root abscess, which then leads to like an abscess on their face, and then they'll need an emergency dental surgery.
Lastly, what is the most important thing to know about caring for a senior cat?
They tend to rely on you more when they get older. I know a lot of people think that they're cats and they're pretty self-sufficient, but as they get older, they do tend to rely on you more. So that's helping them up the stairs, not letting them jump off of any high beds, making sure they have the right water content, changing, making sure the litter boxes change constantly, because they are very sensitive animals, so any little change like having too much pee in their litter box can upset them and cause them to get a little bit stressed out. You want to keep their stress at the lowest level, so no new changes in the house, because that can lead to a lot of different problems. You also want to pay attention to their behavior and changes. If you start to notice anything changing with their behavior, whether it's eating less or urinating outside of the box or not doing their normal everyday activity, then I would contact your vet, because there could be something going on with them. If you have any questions regarding your senior cat, please give us a call at 630-627-7090.